this virus, but they found that in children who were suffering from viral-like illness, this virus was found, which is very, very similar to a common virus called respiratory syncytial virus. Short form, we call it RSV virus. Most commonly affects young children who are less than 2 years. And by 5 years, 90 to 100% of the children are already infected at least once. As the age grows, the severity of the disease with this virus increases. It also depends upon the immune status of the individual. The concern is that we have a very limited facility of diagnosis, but facilities are available. After COVID, we have RT-PCR everywhere, which is the main way of diagnosing it. This is an RNA virus, which is notorious for mutations. And COVID was also an RNA virus. Because of the mutation, it became COVID-19. Since COVID was detected, informed to the world very late. By the time it became too late, people were traveling to and fro from China. That same thing should not happen to this virus, which has the potential to cause death also. Unfortunately, there is no vaccine that is yet developed by the world for this particular virus, and there is no antiviral drug that we have for it. This virus was first detected in 2001 in Netherlands, in Dutch. It's not that it did not exist. It did exist, but it was not diagnosed because it's difficult to culture this virus. But they found that in children who were suffering from viral-like illness, this virus was found, which is very, very similar to a common virus called respiratory syncytial virus. Short form, we call it RSV virus. And that is how the story of this human metapneumovirus came up. And now we know that this virus is very common. It usually affects people in the winter season, and if you talk about the United States where the studies are conducted, 10% of the patients who are admitted with pneumonia have this human pneumovirus, and also 4 to 6% of the children who go to the outpatient with this kind of illness, they have this virus. So we ought to understand what are the characteristics of this virus. It is primarily a respiratory virus, which is ubiquitous. It is all over the world. It's not that it's only in United States or it is in China. It is everywhere. But it is very rarely diagnosed as far as India is concerned. It most commonly affects young children who are less than 2 years. And by 5 years, 90 to 100% of the children are already infected at least once. If you talk about why does it bother us? It bothers us because in children it can sometimes cause pneumonia, it can cause children, even fatalities for that matter, but also in the elderly. As the age grows, the severity of the disease with this virus increases. It also depends upon the immune status of the individual. Like people who have uncontrolled diabetes or who have underlying asthma or COPD or chronic lung disease, the severity is much more and it is potentially lethal also. So if you talk about patients who are immunocompromised, like those who have received bone marrow transplant, there the mortality is reported as much as 80%. So, 4 out of 5 patients would die if they contract this virus. As we know that usually it causes mild fever, sore throat, coryza-like symptoms like viral illness. But in young children, it can even in 16% of cases it causes convulsions like epileptic form of It can cause severe pneumonia requiring ICU care. It can also cause gastrointestinal like diarrhea-like symptoms. Therefore, the concern is that we have a very limited facility of diagnosis, but facilities are available. After COVID, we have RT-PCR everywhere, which is the main way of diagnosing this. RT-PCR and this PCR technique could be for single virus, it could be what is called a multiplex virus. So nowadays, the testing that we are doing for respiratory pathogens, some of the multiplex viruses do include this human metapneumovirus. So it is possible to diagnose. Others are ELISA. The cultures are very difficult, only done for research purposes. So therefore, why the worry? So this is an RNA virus which is notorious for mutations, and COVID was also an RNA virus. Because of the mutation it became COVID-19, and it causes more than 70 lakh deaths, which is also an underestimate actually, and people are still suffering from after effects of COVID. We are still diagnosing corona infection, not COVID-19, which is mild to moderate, but the COVID-19 was a different thing. So worry is that, is there a mutation which has occurred in China which is causing crematoria to be full or the hospitals full, and you can see healthcare workers wearing PPEs, even COVID-like situation. And in the absence of scientific information, which China has not shared with World Health Organization or anybody for that matter, the world is guessing as to what is happening. The worry is that since COVID was detected, informed to the world very late, by the time it became too late, people were traveling to and fro from China. That same thing should not happen to this virus, which has the potential to cause death also. So, because the aircrafts are the most notorious for transmission of droplet infections, because before that I would like to tell you how it is transmitted, to understand why it is important. This virus, when emitted, it basically is emitted by respiration, by coughing. So, at the room temperature, it will be alive for 6 hours. And if the temperature is low, like 4 degrees, it will be for longer time. So either the person is coughing and the other person is in front of him. That's one of the way of transmission, what is called as airborne infection. But it can, more important is transmission by fomites. What are fomites? Fomites are non-living objects like table or chair or book or door handles. You touch it, the patient touches it, and another person touches it, and he gets it, or by the close contact. So since this virus remains alive for several hours, the fomites are also or the close touch is also a way of transmission besides droplet infection. So therefore, it is important to prevent the transmission of this virus. We do not know what is the current situation in India because it is not being tested, but as the government of India has announced that they will be starting the testing facilities soon. So, but the people who are susceptible, like elderly people and those who have asthma or COPD or any chronic lung disease or heart disease, or those who have uncontrolled diabetes, or they are being treated for any kind of cancer, or they have received chemotherapy at any point of time, they ought to be extra careful in avoiding going to the crowded places, because as you go to the crowded places, chances of transmission are there. Those who get viral-like illness like cough, coryza, sore throat, running nose, they should wear a mask, and they should with conscious effort not to go to the crowded places or to work, lest they will be transmitting infections to others. Unfortunately, there is no vaccine that is yet developed by the world for this particular virus, and there is no antiviral drug that we have for it. So, all the efforts should be in case finding and preventing transmission. Lastly, what I would like to say, there is no place for panic. It's not a situation like what we saw during Delta waves of COVID. People were accumulating oxygen cylinders and oxygen concentrators. But to be careful is always helpful. We don't lose anything by being careful. And Government of India, Ministry of Health will take adequate measures for case detection. And one should understand that frequently asked question to me that the several cases has been detected. So far I have not travelled. How did they get it? So during COVID time we were able to pinpoint that people in Kerala, they had travelled from various countries. But this virus is ubiquitous. This is present everywhere. Only thing that now it has been looked for. When you look for, you will find it.